Hi, my name is Navan Huq. I'm an occupational therapy student with the University of St. Augustine. This is my OTD Capstone project preliminary proposal presentation. My project is a webpage to educate parents on normal developmental milestones in preschool-aged children and how to identify developmental delays. I just switched topics this last week, so I do not have as well a command on the literature as I would like, but would still like to share with you what I have gathered thus far. A problem exists regarding parents who may not know whether to pursue early intervention for their children or even how to pursue it. Parents do not have a definitive way to identify developmental delays. According to Lilvest and Granlund, the majority of children in this setting with developmental difficulties are left undiagnosed. Furthermore, a study based in Canada revealed 25 to 30% of kindergarten children showed delays in at least one area of development. So why preschools? A large population of parents choose preschools because both parents are working and are unable to care for their child the whole day. Other parents choose preschools to get a head start on education and enhance the opportunities for their children. Whatever the reason may be, the largest population of children in these early ages can be reached in the preschool setting, but parents may not have the time nor the resources to realize or address these developmental concerns, especially if they do not know about them. Now, there are two essential components to my project. The first component is parental education on normal developmental milestones. This will be covering 3 months, 6 months, 1 year, 2 years, 3 years, and 4 years of age. The second component will be parental education on the identification of developmental delays. This will cover multiple areas, for example, speech, language, motor, cognitive, social, and emotional delays, just to name a few. The web page that I will be creating will contain information on the OT profession, an outline of normal developmental milestones from 3 months to 5 years old, developmental screening section consisting of common delays, areas of delays, warning signs, and things of that nature. And another section will have resources of therapeutic activities for preschool-aged children in order to reach those milestones. And finally, avenues parents can take to address developmental delays, such as formal occupational therapy services via outpatient therapy or school-based services based on the certain state they are in. My project will be done in Texas, so we'll focus on Texas. The significance of this project is to address the preschool population of children with undiagnosed developmental concerns by maximizing their health and ability to reach developmental milestones. So according to Jasmine, Gauthier, Julianne, and Hui, occupational therapy services in preschools help children with and without difficulties improve skills required for education and activities of daily living. Some of the achievable outcomes I believe my project can attain are the promotion of overall health in preschool children, an increase of achievement of developmental milestones, enhancing the skills necessary to achieve developmental milestones, an increase in the levels of school readiness, a reduced prevalence of delays children will have in kindergarten, and as a bonus, the web page I'm creating can be utilized by teachers as well. I have a good bit of learning objectives that I believe I'm going to have to learn in order to do this project effectively, and this will be gathered through my literature review and also my experiential component. So to start, I need to understand OT's role in early intervention, to become familiar with OT's scope regarding early intervention techniques, to understand typical developmental milestones in the preschool ages, to understand OT intervention techniques that promote reaching developmental milestones, to become familiar with pediatric OT developmental assessments, to review literature on OT's role in early intervention in the preschool setting, to understand common developmental delays experienced in those ages, to become familiar with warning signs indicating developmental delays in these ages, to understand the potential areas of delays these children experience, to become familiar with relevant OT models and theory related to preschool-aged children, and to understand school-based occupational therapy services in Texas, to understand what preschool settings are currently addressing in this population, which will be learned via the experiential component, and to become familiar with existing parental avenues to address developmental delays, and finally to understand the role of parents in reaching developmental milestones. My outcome objective, which I've discussed earlier, will be to create an early intervention educational web resource for parents to be able to identify potential developmental delays with a resource toolkit for them to ensure their ability to reach these developmental milestones. So this was the starting point for my project. Thank you for listening.